Good morning. So I have regular rheumatology consultant appointments to keep up with my to make sure that my ankylosing spondylitis is under control. There's nothing that's getting out of hand basically, and nothing that's going crazy. And a couple of things that they do is just to let you know what happens in these kind of appointments. So they take a bunch of sort of tests and whatnot. Like they start off taking your weight and your height. Interestingly, I used to be 5'10.5". I'm now 5'9", so I've lost an inch and a half. I put it there, it might have been there or anywhere. But I've lost an inch and a half in height since I've had ankylosing spondylitis. And they ask you, sort of scores out of 10 for certain things and give you back scores on like average of, how you're feeling from like a physical aspect or a mental aspect, how it's like affected your well-being, also how it's affected you being able to move and get around and things like that, and they give you scores. But a couple of tests that they do is a tragus test. I think it's pronounced tragus. It's TRAGUS test, where they measure from your ear to the wall, where you stand against the wall. So I stood against the wall. The average for a normal person is 9 centimeters. So it's an interesting little test you can do. And mine came in at 16. So my neck is curving. If you imagine the wall, my neck is curving away from the wall. My spine is curving away from the wall. So it's 7 centimeters more than it should be. So that's got worse over the years. That's pretty standard, really. It's kind of to be expected. And one of the other things is the modified Schrober test, which is where they mark a little line on the base of your spine, and then another one. I don't know the distance. I'm not a doctor or anything like that, so I don't know how they actually do it. And then they get you to bend as far forward as possible. And the distance between their marker and how far you can go is how much kind of flexibility, I guess, in your spine when you bend forward. So it's, as you bend forward, your spine should naturally flex and the vertebrae should move and what have you. That, I think the average for someone without any conditions should be 6 centimeters. Mine's only 3, so if you can imagine, I've got 50%, I guess, less movement in the spine going, forwards. So those are the two tests that that came up with, I guess, scores that are easy to translate across to YouTube land. It's probably the best way of describing it. And I thought, okay, so I'll share that with you guys. One of the other things was my results. I have bloods taken very regularly to make sure that the medication that I'm on doesn't cause problems with my liver. As you can imagine, if you were to take anti-inflammatories consistently over a long period of time, your liver is going to take the brunt of, the force, and essentially you're massively overworking the liver. So what you could end up with is a type of scarring similar to, I guess, kind of like an alcohol abuse, fatty liver, stuff like that. So we don't want to do that. Now, I don't drink alcohol, so that's not a problem from that perspective, but my scores are elevated just from the fact that I've been using anti-inflammatories for 7 years or whatever it is. And so my consultant has said, okay, how do you feel about doing anti-inflammatories every other day? And I said, absolutely fine, let's give it a go, let's see what the test is like. So over the next couple of months, I've got to keep a diary. These are the things that we've got to do when we change up medication. Is keep a diary, side effects, things like that, how I feel, if there's an elevated sense of pain. Blood tests have to be taken regularly, so they know, from a score perspective, they keep like loads of scores and things of your bloods to know, if there's any kind of dangerous areas. And the hope is that these elevated proteins or whatever they are come down, but I still manage the pain with taking these drugs. So it's as simple as that. Nice, easy kind of consultant appointment. Nothing too weird this time. It was all good. So he said that. He also wanted to make sure that my costochondritis, which has been a bit of a problem, which is inflammation around the ribs. I've had some problems over that with the past year. One of the downsides of, reducing the anti-inflammatories is that could be the area that gets more pain. So I have to find a way to manage that using something else, whether it's, sort of breathing techniques or exercises, stretches, stuff like that. So it means spending more time with exercising and what have you, which I spend a lot of time anyway, but it's just elevating that time to make sure that I keep the pain at bay, or at least sections of the pain. So that's it for now. So that was just my consultant's update. Other than that, it's all good. So I shall see you later.